Good morning, everybody. I want to make a few comments following the nurses' strike, and then I'll take questions. First and foremost, I want to thank the staff, the volunteers, the DHBs, and the Nurses' Union for their commitment to public safety through the period of the strike yesterday and through the night. There's an enormous amount of contingency planning that took place, and the result of that was that disruption was kept to a minimum. I want to absolutely acknowledge the right of the nurses to strike. A lot of what we heard yesterday was ongoing concern about safety and sustainability of the profession, something the DHBs have attempted to address in previous offers, but it's obviously a concern that remains with the nurses. We now have an opportunity to take a pause. The DHBs and the nurses have received recommendations from the ERA and will need to reflect on those recommendations. I've seen those recommendations from the ERA, but will not be myself commenting on them today. Both sides need a chance to reflect on them before they come together to seek a way forward. Just a few specific comments about yesterday's action that have come up in the media. Again, I want to preface them with a thank you to staff, to volunteers, to the DHBs and to the nurses themselves. Activity was down across the DHBs as, of course, because elective operations had been postponed and demand had been reduced. Contingency planning was effective and oversight of safe staffing then the success of it owes a great deal to the constructive efforts on both sides of the negotiation. Everybody was committed to safe staffing, and I want to thank them for that. No DHB had more nurses on than usual, but hospitals did feel a lot quieter in many cases because of the reduced demand and because of a high level of volunteer activity. So in conclusion, it is time for a pause. It's time to reflect. Many involved in the process have put in long hours, both beforehand to make sure that we had safe staffing and during the course of the strike to ensure that that safe staffing was carried out as planned. Both sides need time to reflect on the ERA recommendations before they return to negotiations. Thanks very much. Questions?
So is it still the government's position that the final offer is on the table?
Yeah, the government has been clear that there is no money on the table to increase the salary package for nurses. We, as a government, did put in an extra $250 million in response to requests that there be more money on the table, but our ability to do that has come to an end. We have to be careful as a government that we're prepared for economic shocks and natural disasters, the likes of M. bovis. We want to manage the economy prudently, and so that is the offer.
Can you see how people can see it as being unfair when you see a $2.5 billion spend on 4 planes and money for Radio New Zealand and money in Taranaki, when you say there's no more money on the table?
Yeah, this government has inherited effectively a whole lot of costs at one time. If there's a natural disaster in Dunedin or Whangarei and we need to get supplies there, we do need aeroplanes. If we have a natural disaster, we do need to be prepared for it. So the significant costs that we've inherited have all come at one time, but we're managing our way through them. We can't address all of the concerns and all of the things we'd like to achieve in one budget or one pay round, but we are taking steps.
The government is billions of dollars under when it comes to its core crown spending limits, as well as its government debt limits as well. And of course you've got the surplus as well. That adds up to billions of extra dollars. We're talking about a potential couple of extra hundreds of $1 million. In the scheme of things, why don't you just take some money out of either one of those lines to pay some of the nurses?
Yeah, as I've said, we're determined to manage the economy prudently. That's something that we have pledged to the public, and we'll continue to do that. We have put money into other areas of government. That's one of the hard things about government. You do have to be clear that you're going to address the priorities as they come up, and we're committed to sustainably funding nursing. That's why we did double the amount of money that went into the offer, but we've reached the end of that process where we have extra money to put in.
You have underspends in some areas of health. Why not use one of those?
Well, as I've said, we've put extra money in, and we do reach the end of the point, the process at some point. The Pharmac savings that are being referred to go back into medicines and so on. There are difficult trade-offs to make. We have doubled the offer. Let's recall that there was an independent process set up, and that process recommended significantly more money for the nurses. The government stepped up and put significantly more money in, exactly as the independent process recommended, and actually went a little bit further than that in putting in additional steps for nurses. So we, as government, are convinced that we have gone beyond what the independent arbitrator came in and suggested and recommended, but there's got to be an end to that, because we also have to manage prudently across the whole economy, and there will be more wage rounds to come for other professions too.
Minister, just going back to your initial example,
Sorry.
there is no more money.
Apologies?
The nurses union says there will be more strikes if there is no more money. Is there any negotiation from the government side about any more money in this offer, or is that the final offer?
Well, look, I'm not going to get into negotiations today. That's for the DHBs and the nurses. I think that the ERA recommendations contain suggestions for a way forward, but it's time to pause. It's time to let the nurses and the DHBs to have some time for reflection and then come back to the table.
Comments that you've just made about having other demands, having made a good offer, would suggest that there is no other money. And in fact, comments by the Finance Minister and the Acting Prime Minister to that effect as well. So are you preparing for more strikes?
I've said that there's no more money for nurses' salaries, and also that we're hearing concerns about safe staffing. There are other things we are doing and addressing. Again, the amount of capital that's been put into DHBs in the budget process is a record amount. That will improve working conditions for nurses, and there are other measures we're taking.
Is the potential funding for money other than salaries in this package?
Look, I don't want to get into the negotiations today. I think that's something that the nurses and the DHBs will reflect upon. They'll reflect upon the recommendations of the ARA and then come back to the table. Today is a day to pause. It's been an incredibly demanding period for everybody concerned. They've been working long hours to make sure we have safe staffing, both before and during the strike action. And a lot of people are tired. This is also, of course, a charged issue. This is people's livelihoods and their working conditions, and so it's time to have a pause and then come back to the negotiating table.
Can you just clarify, you said there's no more money for nurses' salaries. Are you keeping open the option of money, potentially more money for other issues to fix some of the concerns that you alluded to?
Look, I'm not going to get into that today.
So you can't confirm that you're leaving the door open for more money for staffing?
What I'm saying is that we have said that we've been very clear that there is no more money for this salary package.
Minister, where have you been the last few days?
I was not on holiday, as has been reported. I had a commitment to take my family overseas to a holiday. I transported them overseas, came straight back.
So how long were you away?
I think it's 33 hours.
Why was there no comment?
And I was in. I can say also that I was in connection with my colleagues the whole way through that period and in conversation, despite.
I understand that you would have been travelling and having a holiday, but is there a possibility that you could have put out a statement, made some comment, given you are the health minister and this is a massive issue?
It's fair to say that largely this has been an operational matter in terms of the DHBs and the nurses. Obviously, I'm making a comment now. I've been back, and it hasn't been appropriate to make comment during this period. The acting Prime Minister, of course, made comment during his regular media appearances, as is appropriate. This government takes this issue seriously, and so you've had comment where you've needed it.
Sorry, Minister. Sorry, Minister.
Issue though, do you not think that you should have been making comment throughout this?
No.
Sorry, Minister. You weren't on holiday, but you transported your family overseas for a holiday.
My family, I had a commitment from many months ago to a holiday, which I cancelled for myself, but needed to transport my family there.
Why could you not just?
I cancelled it because I wanted to be here in case there was need for
Why
comment.
did you transport your family on a holiday?
I don't want to discuss family matters in this environment. Thank
But the
you.
perception is, Minister, that the first strike in the health sector, significant strike, for 30 years, and the Minister was away out of the country. Do you think that's appropriate?
I think that the record will show that I have been involved at every point, that my colleagues were entirely briefed on it, and that there was no need for any comment, but that I was in touch the whole time I was away.
How do you say you
We
weren't
didn't
on
hear from you.
holiday when you were transporting your family to go to a holiday?
That's what I've been clear on.
Well, it doesn't gel though. I mean, you went on holiday.
I appreciate that that there is a difference of views here.
How worried would you be if there was more strike action?
Look, nobody wants more strike action. It's abundantly clear from both sides that we want to find a way through this. The concerns the nurses have expressed is around sustainability of their profession and the safety conditions in their workplace. And both sides are highly motivated to find a way through. And I think the ERA recommendations hinted a way forward, but actually it's time to press pause to allow people to reflect on those recommendations before they come back to discuss them further.
Can you understand the union's argument, though, that they feel that this government promised a lot for the sector, especially for health, and that now that's not being delivered, and that's why they feel like they're not just going on strike because of money, but because there was a big promise in place and that it hasn't been delivered on?
Don't accept that. I understand their frustration. The health system has been neglected over the last decade. There has been, a real drop in funding. Core Crown health expenditure as a proportion of the economy dropped under the previous government's watch. That's very unusual. We haven't seen that in the countries that we compare ourselves to. This government, in Budget 2018, put the biggest investment into health in a decade, and we're committed to more sustainably funding health, but we can't do all of that in one budget.
The government's been very clear that there is no money left at the moment, but what about when it comes to the next budget, say in May next year? Can you today say to nurses, we're going to earmark X amount of money for you in the next pay round when it comes to the budget?
I'm not going to be making any budget announcements today.
Just on this volunteer action you were talking about, how many, like the hospitals had people who weren't nurses, untrained people coming in to help care for patients, is that right?
The people who volunteer are people who regularly volunteer in hospitals. Safe staffing concerns were addressed, and both sides worked incredibly hard and were committed to that. And I want to thank the nurses as well as the DHBs for the effort that went into making sure that patient safety was preserved and was paramount.
I just want to know how many hospitals, supplemented their nursing workforce with volunteers that otherwise would have been doing jobs as nurses.
I would expect that there were volunteers in all hospitals around the country. That's normal on any day in any hospital to have volunteer involvement. There were a lot of people who put their hands up. I think the public, as well as the nurses, wanted safe staffing as much as everyone else. And so, we've heard stories that in some DHBs, volunteers and actually nurses had to be sent away because there were more than enough to fill the safe staffing rosters. And again, I just want to say thanks to everybody who made that a priority, because that was the priority from a DHB perspective, from the nurses' perspective, and people made it happen.
So how many hospitals had volunteers doing jobs that would normally be done by nurses?
I don't expect there would be any that would have people who were not trained to do an appropriate job. I think the hospitals were absolutely clear that they wanted safe practices throughout.
So you've talked a lot about having the need for a pause. Can you give us some indication of how long this pause is likely to take and where the timelines are at from your point of view?
Well, I think the most important thing is actually that point of reflection. When the parties come together is yet to be seen, but I expect they'll be in touch to discuss the process and the way forward next week.
Are you involved in facilitation?
No, at this stage it is a process between the DHBs and the NZNO. It's an operational matter. Obviously the government takes a keen interest in it because we want to see nurses return to work, and we want to see safe staffing as an issue ongoing that doesn't come up.
Just back on the travel issue, you were in touch
No, I did not break any civil aviation rules.
Just wondering, were you connected to Wi-Fi or were you in contact with something?
As with flights in New Zealand, there were periods where my telephone was off, but colleagues have been covering for me, so there's no
How many hours of
issue.
3 hours were you out of?
Sorry, I don't have that with me. Happy to take a follow-up question.
Did you go visit any nurses while they were out on the strike stage, or was it anything else?
I did visit the centre that was overseeing safe staffing operations and spoke with nurses there as well as with the DHB personnel to gain comfort that things were going according to their plans. And I also thanked them for the work that they had done and were doing.
Does the government feel like it revealed its hand too early by saying that there was no money on the table?
We accepted the recommendations of the independent panel and put that additional money on the table. Obviously that was a significant amount more, and we had to be clear that was all we were able to put on the table.
Are you able to tell us how much more that the nurses union was wanting above that 500 million that the government put on the table?
No.
Can you give us an indication?
No.
Have you been
How
briefed
much
on
would
how
it-
long it will take to clear that surgery backlog from those?
I have not yet been briefed on how long it will take to clear surgery after the postponement of surgeries. I know that DHBs will be working on making sure that they are doing that in the appropriate way. They, of course, every day they have to prioritise which surgeries come first, and they'll be prioritising based on patient need.
How confident are you that further strike action can be avoided?
Sorry.
How confident are you that further strike action can be avoided?
Look, I'm hopeful that strike action can be avoided. That will come down to the parties and the conversation that they have. Of course, everybody wants strike action to be avoided, but today we're taking a pause so that both sides can reflect on the ERA and on the strike action that's happened.
Correct me if I'm wrong, just on specific numbers, but this $500 million increase, that would pay for a 12 to 15% pay increase over a number of years for nurses. They were saying that was 18%. Now, I believe that's correct. What would it cost to up the pay of that 18%? What's the
I'm not going to enter into negotiations today. We've been clear that the 3 plus 3 plus 3 was the offer that was made. There are a number of other aspects around it. But today we're having a pause, and then those sides will go back and see how they can work their way through the issues.
I'm not asking you to negotiate, I just want to know how much it would cost to give them what they want.
I don't have the current figure of what nurses are asking for.
How long
Can
can we
you clar-
survive a strike? Like if they're talking about further strikes, I mean, strike action can go on for months and months and months. How long do we have before this becomes actually a serious issue that delays, not just electives but other forms too?
Look, today's a day for a pause. I'm not going to reflect on what happens after this. Each side needs to go away and look at the ERA recommendations. I'm hopeful that there is a way forward through that, but both sides will need to reflect and then come back to the table.
Can you clarify which 33-hour period you were away for?
I left on Tuesday morning and was back on Wednesday evening. Thanks very much.
The gangs, because there's two things that come through here in some ways, and they're linked.